Hello, my name is Jaima. I'll be talking about the profession Doctor of Physical Therapy, which is what I plan to pursue. In June, I plan to apply to PT here in Florida. I currently work for Optimal Performance and Physical Therapy, which is an outpatient clinic for physical therapy. So I will be talking about also my experience while working there. The scope of practice for physical therapy, it differs between state to state. No physical therapy therapists are allowed to prescribe medication, or they are not allowed to diagnose like physicians do. However, they are allowed to speak to physicians about certain complications a patient might have, or certain difficulties. So the profession of physical therapy, they have three components to the scope of practice. They have professional, and they have jurisdictional, and they also have personal. That jurisdictional scope of practice have to do with a certain state. So Florida has certain rules or certain regulations that physical therapies have to follow in order to meet that requirement. Other professionals PT work with are medical doctors, OT, nurses, and other physical therapists itself. For outpatient clinics, physical therapies mostly work with other physical therapies, but they're also talking to medical doctors regarding the patient's rehab process. As for the daily duties, I've also shadowed at Moffitt, so I'll be also talking about that. So, daily duties include an outpatient clinic that includes coming in, assessing the patients, talking to the patient, how are they feeling, if they're, for example, if they're coming in for an ankle injury, how is their ankle doing, how can they perform certain activities that they weren't able to perform when they first came in, and things like that. As for work settings, they have many settings. So they have outpatient, inpatient, nursing home, travel, and home health. Hospitals are the most desired because they pay them between hospital settings and travel and home health. They are the three settings that they pay the most. In my experience working in outpatient clinic, it's very quiet, and patients love outpatient clinics a lot more than hospital settings. This is a physical therapist and patient. Here we have the requirements for the profession itself. As education, there's now they require you to have doctorate of physical therapy, but most of the physical therapists that I work for, actually they have a lot of years of experience, so most of them don't have their doctorate, they just have their bachelor's, because before that was all that it was required. However, now they require professionals to have their bachelor's degree, which include a 4-year program from an accredited university or college, and also they require you to have a doctorate of physical therapy. And again, you can exceed in this field. You could also obtain your PhD, which would be geared more towards the research in physical therapy. The exam requirement to enter the program, the physical therapy program, that is a GRE. So this is standard for almost all schools. However, some of them don't require you to have your GRE. License and requirements. This is once you complete your Doctor of Physical Therapy program, you are supposed to take the NPTE, which is called the National Physical Therapy Examination. This is what gets you in the process of being licensed as a physical therapy. So after you finish your program, then you take this examination, then you become a licensed physical therapist, and you are able to work in the state that you took this exam at, because certain states require you to take different examinations for that particular state. As for volunteer and clinical hours, they don't necessarily require you to do volunteer or clinical hours. They call it more like a shadowing, observing hours. For this, most schools require you to have between 100 to 200 as a standard. I myself obtained 100 so far. and that's all that I will be obtaining for now. But certain schools, they do not require you to have absolutely any volunteer or shadowing hours. I know USF is one of the schools that as a minimum they require 30. However, they recommend you get 150 hours of shadowing. This is a pelvic floor therapist working with a patient. Continuing learning. So for continuing learning, medical insurance required to maintain licensure certification. So I spoke with one of the physical therapists where I work, and he stated that physical therapists required to take a exam or certain courses every 2 years, approximately every 2 years, for the renewal of the license, and that also depends on the state that you are. Professional organizations that are directly related to this field is APTA, which is the American Physical Therapy Association, also the FPTA, which is for the state, Florida Physical Therapy Association. They actually help you a lot to get connected with many physical therapists in the area. And certain journals are for physical therapy at PT now. Article search, PubMed, which is they have many articles and research that you can read in journals relating to this particular field. Here we have my timeline. So right now I am in the experience section where I am getting shadowing hours. And like I mentioned before, I'm getting my shadowing hours. I'm off it and OPPT since I do work there. Coming in June, I will be taking my GRE and also at the same time applying for physical therapy schools. I will apply to approximately 8 different schools in the state of Florida. Once I finish my process, I will be jumping on to a milestone, which is start my physical therapy school, and that is going to take place from May through August for the acceptance and to be accepted and interviewed. And I plan to keep going. So it says while taking course. So my other milestone, it says while taking courses, learn about specialties in physical therapy. Learning about specialties in physical therapy is very important for me because I plan to work as a pelvic floor physical therapist and also as a clinical physiological physical therapist. So those people work with electrodes and other things that have to do with muscles connecting with nerves. Next, for my process section, it says focus in my courses and start looking into what state to practice in, since Florida is not a state that I want to personally practice in. Next, it goes graduation. So it says get ready for graduation while studying for the boards. That's for 2021 and 2022. By then, I'll be ready to take my examination, therefore become a physical therapist, which is what my next part is in the timeline. Says board certification, which is take the boards and pass, and that's going to be by May 2023. Then after that is become a doctor of physical therapy. That's when I will start practicing as a physical therapist and perhaps look into different residencies, for example, pelvic floor physical therapist, since that is what my goal it's ultimately is become a pelvic floor physical therapist. And here are my references. So I got a few references from Dr. Frizzell, which is the physical therapist on my job that I spoke with and I personally interviewed. I also grabbed a few points from Dr. Miller, which is one of the speakers for our lectures. And yeah, this is my presentation. Thank you very much.